While I was editing this video, I noticed something that you're about to see in the remainder of it, and I call it word scramble. So part of chronic illness for me has a neurological effect. So if I get overly tired, overly stressed, I'm overly tired right now, words get scrambled, phrases come out backwards, I can't find the word I'm looking for, they get mispronounced. Sometimes in this video I will flip-flop the words Hizentra and Hycuvia because I was extremely tired, I was very stressed. I don't know why my camera made everything look yellow in these two videos, but I'm trying to figure that out, so hopefully that doesn't happen again. But I almost re-recorded it to fix the word scramble portion of it, but that's not really staying true to what the channel's about. The channel is about showing you life with chronic illness, and this is a part of it. Overly tired, overly stressed, word scrambled. That's part of living with chronic illness. So I wanted to give some kind of explanation for what you're about to see in the rest of this video. So, hey. Okay, I know my phone is super crooked. This phone stand is liable to just kerflunkle right over any minute. So we'll pick back up with talking about my visit to the immunologist today. And if I look like I'm really uncomfortable, it's because I am. Since I had this surgery on my neck, I have to wear this horrendous back brace for 45 minutes a day, and it's very uncomfortable. We'll talk about that on a video another day, because this is not healing well. So, if you've seen my other videos, you know I have common variable immune deficiency. It's a subclass of primary immune deficiency disorder. It means the portion of my immune system that's supposed to fight off bacteria and viruses doesn't work. I almost have zero without immunotherapy. But the part of my immune system that attacks itself and causes autoimmune conditions like lupus, rheumatoid arthritis, Hashimoto, psoriasis, all that, spectacular at doing its thing because I have all the things. And the worst part is when you have lupus, the treatment for lupus is immunosuppressants. Now, immunosuppressants are not targeted. They can't just pick and choose which portion of your immune system they want to suppress to control your lupus. So I can't take any of them because they're going to suppress the immune system that already doesn't work. When I was first diagnosed, my numbers ran between 300 and 600, which are almost unheard of for somebody to be as low as 300, but I was, and that's why I was sick all the time. My first course of treatment was Hycuvia. That was done in my immunologist infusion center in his office. I hated Hycuvia. I'm just going to lay it out there. If you're taking Hycuvia, more power to you. I pray that you do well. But for me, it didn't work. It was 5 hours once a month in the infusion center getting the Hycuvia infusions. And the way Hycuvia works is they put an acid-based substance in first to open up some, I guess, fatty tissue in your body so that it can accept the volume of Hycuvia that you have to have when you are only getting it once a month. It made me sick. I had migraines. I felt like I had the flu for 3 days afterwards. My numbers moved up between 900 and 1,000, which is still not great. So when when COVID came along, I was still on the Hycuvia, still having to go to the infusion center, terrified because they were also giving, and I'm going to butcher this word, remdesivir, whatever, that word, those infusions in the same infusion center, just on a different side of the room. You can't be mixing somebody who doesn't have an immune system with somebody who has COVID. That's ridiculous. So about finally, probably I think, this is 2025, so probably 2021, 2022, I swapped over to doing Hizentra at home. Now, Hizentra is once a week. It's 4 needles in my stomach instead of the 2 from the Hizentra, but it only takes an hour or an hour and a half. It just, varies. And that's prep time and everything. Now, 50 minutes before time, I still put my numbing cream on, put my Tegaderm over the numbing cream, and you have to let that sit for 50 minutes before you go sticking those ginormous needles in your stomach to try and help numb that up. Sometimes it works, sometimes it doesn't. This past week, I don't know what happened. It didn't work. I felt everything. But the Hizentra works much better for me. My numbers are now between 1100 and 1200 versus 900 to 1000 with the HyQvia. I'm doing it at home. The only side effect is sometimes I'll get a headache, and I'm usually really tired afterwards. Now, it's just like with the HyQvia, you have to do something to get your blood flowing afterwards because there is a risk of blood clots. So when the Hizentra is finished, I get on the treadmill for 30 minutes. Then I'm done for the day. I'm exhausted. I need to go to bed. But then I'm fine. There's no feeling like I had the flu. There's no migraines. It's, I think maybe twice in the whole time I've been using it, I've had a migraine, and I'm not sure what caused that. They do recommend that you take a Benadryl before your infusion, just because it is a medicine that's made from human plasma. Each time it's going to be just slightly different, and you don't want to have an allergic reaction. And I also keep an EpiPen just in case. I've never had to use the EpiPen, so don't let that freak you out. I also had to have it with the HyQvia. It's just a precaution. So today was my regular 6-month visit with my immunologist. I say with my immunologist, but I did not see him. We're going to get to that. I went to see them in April, the end of April, because I had to be cleared for the surgery that I had done in May. I still don't know what my numbers were from that, but whatever they were enough that there wasn't a concern with my surgery. I did get IV antibiotics for 2 days after my surgery, just as a precautionary measure, but I didn't have any infection issues. There was no infection with my incision or anything like that. So today, when I went to see them, I had some questions about the Hizentra dose, about the number of needles that I have to use. I didn't get any of my questions answered. Do you want to know why? Because you see a nurse practitioner. Every time I go, I see a nurse practitioner. Now, I'm not knocking these nurse practitioners in any way. The ones at this office are great. They're nice. They listen. But I didn't get any of my questions answered because they're not the doctor. I'll have to check with the doctor. I'll check with the doctor. I'll check with the pharmacist. One question was, do we need to still stay at such a high dose of Hizentra? Since my numbers are up, can we just experiment and go down just a little bit? I guess I kind of got an answer to that because that was kind of I don't think that's a good idea, but I'll check with the doctor. The next question was, can we go from 4 needles down to 2? Because if I could use 2 for the enormous volume of HyQvia that you get, I mean, think of a full IV bag that's going in 2 needles in your stomach with HyQvia, then it seems to me that I should be able to use a 2 needle set for the much lower weekly dose of Hizentra. So she'll check with the pharmacist, she'll check with the doctor. I didn't get my questions answered. I didn't get my lab work done because it's typical for me. You can't find a vein, and when you find a vein, it moves. So I'm not blaming them for that. I'll have to go to the hospital where I work and try and get it done there. And she also only had the option of trying one arm because due to where I work, I have to be tested for TB every year. Everybody who works there does. They don't test for TB with a skin test. They do it with a blood test. And I'd already had my other arm dug around in to find a vein to get that test done. She couldn't touch that arm. So she only had one option. She couldn't get it. That's not her fault. But I didn't get my lab work done. And then when I was checking out, I asked, and I want, if you have CVID or PIDD or any of the other primary immune deficiencies, do you see your doctor or do you always see a nurse practitioner? Because I don't think this is normal. I have not seen my doctor in over 2 years. It's always a nurse practitioner. And again, I'm not down in nurse practitioners. They do a great job. But this diagnosis and this infusion treatment literally holds my life in its hands. I mean, ultimately, God holds his life in my hands. But this treatment, my life and my health depend on it being correct. And I haven't seen my doctor in 2.5 years. That's not normal to me. So when I was checking out, I asked the girl, when she made my appointment, I said, excuse me, but I would really like to see Dr. next time and not a nurse practitioner. And she said, he only sees high priority patients now. He doesn't see any other priority patients. And you're listed as a medium priority patient. What does it take to be a high priority patient? Because I'm eat up with chronic illnesses and my CVID is extremely severe. what does it take to be a high priority patient? What do you mean he doesn't see his other patients anymore? Well, he has 3 offices now, and he only really goes to one. Now, I'm not educated enough to know the answer to this, but I have worked in healthcare for a really long time now, and that is where my degree lies, is in healthcare administration. So I'm not comprehending how a physician can have an office where I go, which is quite a drive for me to get there, that has 2 different infusion centers in it on 2 different floors. People are getting infusions on both of these floors. A specialty pharmacy, an allergy clinic, an allergy shot clinic, and then the immunocompromised clinic. But there's no doctor there. There's only nurse practitioners. He does not come to this office. How does that work? I'm very confused by that. And I said, well, what does it take to get me to be able to see my doctor and not a nurse practitioner? And she said, I can take a message and we can ask him about it, but he doesn't see medium priority patients. I found that a little offensive. I mean, what is a high priority patient? I don't understand. This is very confusing to me, and I'm not very happy about it. But the truth of it is, I don't really have an option, because where I live is a very small town. I work in another state because there's really not work here. But in the state I work in, I work for a very large hospital system. I love my job. I love my hospital system. But even they don't have an immunologist that is closer than 3 hours away. Well, 2.5 hours away. The hospital system in which my immunologist is attached to doesn't have any other immunologist. I have looked in the town, which is the capital of my state, where my endocrinologist is. There's not even an immunologist there, and that's an hour and a half away. I have to drive an hour and a half to see an endocrinologist. So I don't really have a choice but to go with what they say and see the nurse practitioner, but I find that incredibly frustrating. I want to see my doctor. I want my questions. When I'm coming to your office and my insurance is paying you all this money and I'm giving you a copay and I am your patient, I am extremely reliant on immunotherapy to stay healthy and in this world. I want to see my doctor. I want my questions answered. I want to feel like I matter to the practice that is treating me, and I didn't feel that today. Again, I'm not down in the nurse practitioner, but she's not the doctor. And you never see, it's like he has a revolving door of nurse practitioners. You never see the same one. For 2.5 years, I have not seen the same nurse practitioner. So I'm just really bothered by that. But I also wanted to talk about the difference between Hizentra and Hyqvia, so that you know that if you're dealing with this, you have options, and there are still even more options out there besides Hyqvia and Hizentra. It's just when I knew Hizentra was not going to work for me long term, so when Hyqvia came along and I had to kind of do battle with my doctor and my insurance company to swap to Hizentra to be able to do it at home, and I mean, from a financial standpoint for the doctor, I can see the point for that, because the amount of money that you get for doing Hyqvia in your infusion center in your office is up here, versus the amount of money that you get for prescribing Hizentra that a patient does themselves at home is down here. I get that, but I feel much better doing Hizentra at home. I'm doing it in the comfort of my home. It's once a week for an hour and a half versus once a month for 5 hours. That's not sustainable for somebody who works. I can choose when I do it. The medicine is delivered to my home. I don't have to go anywhere and pick it up. So there are options out there, and it's important that you know that. It's important that you be your own advocate and choose the treatment that works best for you. So I'll be interested to see if anybody has experienced this where you just don't see the doctor anymore, and you're told you're a medium priority patient and he only sees high priority patients. I've not heard that one before. So I'm going to show you a little footage from inside the immunologist office, just because I love this chair that's in there, and I want to know where I can get one of these chairs, because they couldn't tell me that either. So I hope you have a wonderful rest of your day, and I'll see you in a little bit because we're going to talk some more about this horrendous brace and what's going on over here. So see you next time. Bye. Hey, so we are at the immunologist office today. I have to come every 6 months to get lab work done to check my immunoglobulin levels. I got some questions I'm going to ask today about my infusions. I'll let you know how it goes when it's time to go. Okay, so this is my immunologist office, and I just have to say I miss these chairs. I need one of these chairs for when I do my infusions at home. I used to do them here in the office, and these are the chairs that we did.